Good afternoon. I want to start, first of all, by talking a little bit about the weather today. This morning, we spoke with MEMA and the Department of Public Utilities about preparations for the storm that's starting to impact Massachusetts. This weather event is expected to last until 8 p.m. and has the potential to bring damaging winds, heavy rain, and thunderstorms to many parts of the Commonwealth, particularly across southeastern Massachusetts, including the Cape and Islands, as well as the Metro Boston area. To prepare for this, our DPU has worked with the state's utility companies to stage crews around the state and call in the necessary personnel to work on power restorations once sustained winds are below 30 miles an hour and conditions to do so are safe. In response to COVID-19, the utilities have established protocols to minimize person-to-person contact before, during, and after expected outages, like we anticipate experiencing with today's wind event. We're expecting those outages to take place as a result of downed trees, tree limbs, and power lines, and we are encouraging people to plan ahead, make sure their cell phones and other electronics are charged, sign up for alerts, and make sure you have a flashlight and an emergency kit ready. We're also working with hospitals, critical care facilities, newly created COVID-19 facilities, and the utilities to ensure continuity of service there. Our state's hospitals have multi-day backup power generation on site, and utility companies are prepared to deploy generators to critical care facilities to ensure that service is never interrupted. Folks should continue to monitor the forecast, and if you have questions, go to mass.gov/MEMA, M-E-M-A. With respect to COVID-19, Massachusetts continues to see extremely high levels of positive tests across the Commonwealth. All the data continues to indicate that the days and weeks ahead will be difficult ones. They're going to be difficult on our frontline medical workers as we expect hospitals to see more COVID patients. They're going to be difficult on our first responders who are likely to see an uptick in emergency response calls. And this will continue to be a difficult period for people who are out of work and for everyone who's doing the right thing by staying home. This hasn't been easy, but across the state, people have stepped up, adapted to these trying times, and are doing their part to stop the spread of the disease. The command center we launched and every branch of state government is also stepping up, so Massachusetts can respond to this emergency with every possible resource. I want to give a couple of updates here. First, on mobile testing, which is a program we put in place 2 weeks ago working with the Massachusetts National Guard and the Broad Institute. This effort provides on-site testing at long-term care facilities. Last week, the program was expanded to include assisted living residences and Department of Developmental Services group homes, including Rentham and Hogan. Since we launched this initiative on March 31st, more than 3,700 on-site tests have been collected at more than 220 facilities. In addition, facilities with trained clinical staff can now conduct their own testing by ordering test kits through the state's mobile testing program. As of this weekend, another 35 facilities have made requests, and we've sent almost 4,500 tests to them to be used. We'll continue to learn and adapt our approach to support these critical facilities and the people who live and work there as we move forward. As COVID-19 continues to impact our communities statewide, some places are hit harder than others. In the last few days, our command center has been working directly with the City of Chelsea and with City Manager Tom Ambrosino. Several state agencies are ready to provide resources that they've identified. Working with partners in Mass General Hospital, we have now increased testing capacity fourfold in the Chelsea area. In partnership with the city and the Salvation Army, MEMA is implementing a food plan to increase food kits from 100 a week to 750 a week by the end of this week. There are about 35 meals in one of those food kits, so 750 kits translates into about 26,000 meals. The Mass National Guard will play a key role in providing logistical support and delivery of these products. For individuals who are homeless and who have tested positive for COVID-19 in Chelsea, the Command Center is helping to set up an isolation hotel. And for individuals who test positive and are unable to stay with their family due to density issues, the Command Center and MEMA have also provided technical assistance and support to both Chelsea and Revere to access isolation capacity at the Quality Inn there. MEMA is providing supplies to set up the hotel, like linens and PPE, and will begin providing food services when the hotel opens. Working with MEMA, the Command Center is also contracting for an additional 50 beds at the Quality Inn to plan for potential overflow, which can be used if necessary. You've heard us say many times that it's a constant battle to get PPE, personal protective equipment, in the door to support our frontline healthcare workers and to protect patients from COVID-19. Yesterday, the Command Center posted a PPE distribution summary online, which will be updated regularly, that describes the kind of personal protective equipment that has been distributed across the state and where it's been distributed to. That includes over 360,000 aircraft masks, over 700,000 masks, 160,000 gowns, and almost 2 million gloves. This PPE has gone to nursing homes, hospitals, health centers, local public safety, boards of health, and other healthcare facilities across the Commonwealth. We also received the additional 200 ventilators from FEMA, which are now being examined and will be distributed starting later today or tomorrow morning. And we continue to work with a variety of supply chains, but we've also looked into our own businesses right here in Massachusetts to help us produce life-saving gear and supplies. It's no surprise that the COVID-19 outbreak has been devastating for our economy in every corner of the state, and especially for small businesses and brick-and-mortar shops. In response to this public health crisis, doors have temporarily shut, and those who are still operating must do so under tight social distancing guidelines. To say this is a difficult time for them would be an understatement. But as usual, we are blown away with the resiliency, imagination, and creativity of many of our entrepreneurs and business owners. There's incredible work going on behind the scenes in our local businesses and companies. And through some unique partnerships, we've created and funded a program to assist local manufacturers so that they can make PPE even if it's not in their business model. To respond to COVID-19, our administration established the Manufacturing Emergency Response Team. This team came together through the Executive Office of Housing and Economic Development, the leaders of the state's Advanced Manufacturing Collaborative, and the Mass Tech Collaborative, which manages it. It includes people from academia, industry, and government with a shared mission of creating new products to fight COVID-19 here in Massachusetts. The MERT, as we're calling it, has been working in coordination with the Command Center to help Massachusetts manufacturers pivot their operations to make PPE like gowns and face shields, but also swabs, ventilators, sanitizers, and thermometers. MERT helps companies identify what types of items we need, gives regulatory guidance, and helps coordinate supplies and staff help. Our administration has made $10.6 million in grants available to companies for this operation. $5.6 million is coming through the existing M2I2 program, thanks to the Mass Technology Collaborative and the Advanced Functional Fabrics of America. The Board and Investment Committee of the Mass Life Science Center made an additional $4 million in capital funding available, and the Executive Office of Labor and Workforce Development and the Commonwealth Corporation has made $1 million available to train existing and new workers. The program launched on April 2nd, and we've already seen the benefits. They've established a procurement portal for manufacturing companies to use and have heard from nearly 400 manufacturers who are looking to help. 260 of these companies are from Massachusetts. This afternoon, Secretary of Housing and Economic Development, Mike Keneally, is here, as well as Mass Tech Executive Director Carolyn Kirk, who, along with Mike Tomasi at AccuRounds and partners from MIT, WPI, UMass Lowell, and the Mass MEP, have made this effort possible. Members of the MERT team also include experts from R&D universities who are connecting with companies to provide guidance in areas like FDA approvals and testing. To find out how your company might be able to support this effort and to request funding to adapt your operations, please visit masstech.org/m-ERT for more information. You can fill out the appropriate application, and the MERT team will get in touch with you. Some companies are already making face shields, test swabs, and medical gowns. Form Labs in Somerville is 3D printing diagnostic swabs. Merrow in Fall River is making gowns. They were one of the first companies to reach out to us. Love Pop here in Boston is going from making greeting cards to face shields, gowns, coveralls, hoods, and shoe coverings. And New Balance's factory in Lawrence is working to make shoe coverings, gowns, and masks. We're all pleased that one of those companies, 99 Degrees, is represented here today. Brenna Schneider is the CEO and founder of 99 Degrees. You may be familiar with this Lawrence-based manufacturer for making performance activewear. But after working with MERT, 99 Degrees has spent the last few weeks making the adjustments necessary to safely produce PPE to fight COVID-19. Starting today, 99 Degrees will begin manufacturing 1 million Level 1 isolation gowns for the medical community. An incredible gesture of commitment, generosity, community, and creativity. And on behalf of the Commonwealth, Brenna, I just want you to know we are grateful to you and to the hundreds of manufacturers here in the Commonwealth and elsewhere who are stepping up to the plate. Brenna?
As the governor said, my name is Brenna Schneider, and I'm the founder and CEO of 99 Degrees, a U.S. performance activewear manufacturer based in Lawrence. We produce apparel for some of the world's most forward-thinking brands, and we are a team of 150. In mid-March, I first understood the gravity of COVID-19's impact on our community, economy, and on our business. My first reaction, like many of us, was fear. How do I keep my team safe? How do we withstand ongoing interruptions to our supply chain and operations? We made contingency plans. And then almost immediately, we learned that first responders and the medical community had an urgent need for critical personal protective equipment, also known as PPE. I felt a responsibility to put our manufacturing model to work. We began looking into how to make masks. At the same time, the state's manufacturing emergency response team assembled. We worked together, creating statewide manufacturing response. The MERT helped me understand that other critical PPE products were needed, not only masks. They provided focus and direction to pursue the PPE that we could best make and scale. And they provided clarity and rigor to ensure that we weren't building just to make something, but to make FDA-compliant product that protects. They helped advise on FDA requirements, rapid testing, and they bridged industry with the scientific community and academia. As a result of MERT's guidance, we quickly shifted our focus to isolation gowns. Every day for the last few weeks, we've had multiple calls with the state's MERT team. Understand that very little PPE is made in the US. We've learned a new industry, evolving hospital needs, FDA regulations, and a supply chain by drinking from a fire hose. This requires open collaboration and speed. Both were enabled because the MERT leadership was already known to manufacturers in the state. There was already an innate sense of trust and a previously laid groundwork for collaboration and innovation. Our network was put to a test. And it is my opinion that that network is the very reason that we have been able to respond so quickly. Normally, it takes 6 to 18 months to develop a new product. In this case, it has taken 3 weeks. At the same time, my team has worked to design and develop FDA-compliant, reusable, and disposable isolation gowns for mass production. I'll show you one here. We have retooled, purchased new machines, and have prepared to manufacture. We've also, importantly, redesigned our manufacturing facility to ensure social distancing. We've secured our own PPE and cleaning products and created new procedures and trainings to keep our teams safe at work. This is no small feat, and it cannot be done alone. The collaboration, even among competitors, has been one of the most inspiring and energizing parts of this response. The state not only called on its manufacturers to respond in a time of need, but has also shown commitment to supporting us. We are proud that in the coming weeks, we will manufacture 1 million isolation gowns for MEMA and are building the capacity to produce millions of gowns for hospitals and healthcare networks across the country. The Manufacturing Emergency Team funding is just another way in which the governor and MERT have heard the needs of manufacturers and have provided essential support. I'm thankful for the opportunity to apply for this funding. I'm proud to be a U.S. manufacturer and a Massachusetts manufacturer. I'm proud of my team and our willingness to put down everything and dedicate ourselves to this response and to our team's health and safety. I take seriously the opportunity to put U.S. manufacturing to work to support the medical community, and I'm also thankful. I'm thankful to the countless CEOs, companies, partners, and competitors who have come together in the spirit of collaboration to respond almost instantaneously to this need. I'm also thankful for the governor's guidance and steady hands throughout this crisis, and I'm thankful for MERT's support for our state's manufacturers. It goes without saying that I am most thankful to the medical professionals and first responders who are putting themselves and their families at risk for our communities. Thank you. And on behalf of Massachusetts manufacturers, I assure you that we are doing everything within our power to keep you safe.
Governor, Lieutenant Governor, Secretary Keneally, Carolyn, Kirk, and Brenna. Brenna, as you know, we have been chasing personal protective equipment since the very beginning of this COVID pandemic. And one of the things that we have been most in need of, in addition to everything, has been surgical isolation gowns. And the fact that we can have Massachusetts manufacturers be the provider, the manufacturer of these, obviously not only does it increase production, but a fast distribution across the Commonwealth. So thank you. I'm actually inspired by the work that you do. Just a couple of updates from the command center to augment what the governor has said. So I just want to give some clarifications around the crisis standards of care that were announced last week. It's important to reiterate that these guidelines are voluntary, and at their core is to mitigate against unconscious bias in making critical medical decisions during a pandemic or crisis where there are scant medical resources. Some Massachusetts hospitals already had standards, others did not, and it is for that reason that these voluntary guidelines were requested and developed. Hospitals are urged to use these guidelines as a framework and adapt them in accordance with their own standards of care and in a manner that limits any inequitable impact on individuals and communities of color, immigrants, people with disabilities, and other vulnerable and historically marginalized communities. Hospital triage committees should include a diverse group of clinicians, including the hospital's chief diversity officer, human rights officer, or patient advocate. We hope that these guidelines, these templates, never have to be used, which is why, as you know, we are pursuing aggressively medical supplies, including ventilators, and setting up alternative medical care sites across the state to flatten the curve to protect our healthcare resources in preparation of a surge. We've been planning and continue to plan for the worst scenario with the fervent hope that these guidelines are never used. The guidelines explicitly call out the factors that have no bearing, include but not limited to race, disability, gender, sexual orientation, gender identity, ethnicity, ability to pay, socioeconomic status, perceived social worth, perceived quality of life, immigration status, incarceration status, homelessness, or past or future use of resources. They are irrelevant and not to be considered by providers making difficult decisions if that time comes. It is important to acknowledge that people of color, people with disabilities, individuals who are marginalized, and others who are particularly called out in the guidance are most vulnerable to illness, death, and burden of disease. We must work to mitigate these long-standing institutional barriers in order to improve equitable access to care and treatment. In the event that a hospital considered implementing their own crisis standards of care, there's an affirmative obligation to notify the Department of Public Health in order for DPH to monitor, intervene, and offer alternative options if they exist. The CSCs also provide for a process of rapid reassessment and an expedited appeals process. As we all know, New York, which is the epicenter of the pandemic, has not utilized their guidelines. No Massachusetts hospital is utilizing CSC guidelines. And frankly, if we had no ethically based guidelines for the fair distribution of scant resources of care, inequities would occur. Where are we today in terms of hospital beds and alternative service centers? In addition to monitoring daily bed utilization, we continue to have frequent calls with hospitals to monitor their capacity and monitor the ASCs, otherwise known as alternative service sites or centers. The percentage of available beds is about the same as it was last Friday when the governor spoke about this. We will also regularly post on our website hospital capacity on a daily basis. Just some numbers. The Boston Hope update as of last night, the overall patient total was about 36. And at the DCU, UMass Memorial is currently caring for 10 patients. So statewide, we have approximately 50% of our hospital beds are occupied, which obviously means that nearly half are available. Clearly, there are regional differences. However, I would remind everyone that given that we are seeing more than 2,500 confirmed cases, new confirmed cases a day, we won't know the full impact of whether individuals are hospitalized until the next 7 and 10 days. So this is just the eye of the storm. Thank you. Governor?
Questions?
Governor, realizing that you emphasize the importance of staying vigilant and taking precautions to limit the spread of the virus, what kind of planning have you done, if any, to aid in the eventual reopening of the economic sectors that have been shut down?
So I'm going to start by reminding everyone of what the Secretary just said, which is that we've had 2 or 3 of the highest days of positive tests that we've had since we started testing. And some of that's obviously due to the fact that we're testing a lot more people, but part of it also has to do with the fact that we have expected and anticipated that around the middle of April was going to be the worst time for us with respect to the surge. And I really want people to focus on that. And that means all the things we've talked about before with respect to wearing a face covering if you're going out or you're going to be in a place where you can't socially distance from people, continuing to engage in the appropriate hygiene that we've talked about, staying at home unless you have an essential job or an essential reason to go out, and doing everything you possibly can to stop from either getting the virus from somebody else or giving it to somebody else. But we have had conversations with a variety of folks in our economic and healthcare communities and in our public health community about what life might look like once we get past this. And we will talk about that at some point. But I really don't want people to start to think today that this is over. I want people to realize that today is the beginning of what we expect is going to be a very difficult period. That's why we were busy putting up thousands of extra beds, staffed extra beds, equipped extra beds to make sure that our healthcare system is adequately supported and able to deal with the surge. But certainly we all believe that there should be a planful process with respect to what happens next, and we're talking to people right now about what that might look like.
Question for the secretary. May 4th isn't that far away. For a lot of parents who have school children at home right now, any additional guidance on that?
So we've said that at some point this month, we would make a decision with respect to schools, and we will. And Commissioner Riley at the Department of Education and Secretary Pizer at the Executive Office of Education spend a lot of time talking to their colleagues in local government, primarily superintendents and school committees and others. But I think we've said before that in the meantime, what the department has tried very hard to do is to work with its colleagues in local government and local education to ramp up programming and educational opportunities for kids while they're home that can be done remotely using either online services or in some cases available curriculum through public television. We know this is an issue that's in front of us, and we'll make the decision at the right point in time.
Governor, on the masks that were brought over on the Patriots plane, were you aware there were not just N95s, but the K N95s? And what was the breakdown of N versus K, given some of the concerns about the other model?
So the biggest issue we had heard over and over again was the need for respirator masks. And we worked very hard to get a significant shipment of those available for people here in Massachusetts. We're grateful for everybody who was involved in that effort, and that plus some of the other initiatives we've pursued have made it possible for us to make respirator masks available throughout the Commonwealth to people across a wide variety of frontline positions. In addition to that, the work that was done by the Commonwealth, the Mass Hospital Association, and partners to deliver the Battelle machine here, which can make it possible to use masks. They say as many as 20 times. We'll see. I'm thinking it's going to be more like 5 or 10. We'll also continue to expand the useful life of those machines. All those masks are FDA approved. All of them were inspected.
Do you know where they were distributed to, the KN95 in particular?
I think they went to hospitals, nursing homes, and other healthcare providers, same as the others.
Governor, earlier today that it's incorrect that it will be up to governors to decide essentially when their states reopen. You know he's been pushing for this May 1st date or around then. Can you respond to that or kind of explain if he says he's going to reopen the country, what will happen in Massachusetts?
There's been a lot of pretty thoughtful work done by a lot of people around what some of the preconditions would be or the sort of things that should be in place for a soft opening, if you want to call it that. I don't think anybody thinks you can just flip the switch at any point in the not too distant future, given the fact that the surge is actually not the same everywhere. It's a wave that's going to play out across the country at different points in time. And most of the preconditions that have been part of those discussions have involved a variety of indicators. You know, one of the indicators is you really have to be past the peak. That's like number one. And there are a bunch of parts of the country that aren't where we are at this point in time. There are other parts of the country that are ahead of us. There are other parts of the country that are behind us, okay? But everybody's basically said people need to be past the peak. Number two, everybody said there needs to be some recognition of what would be designed as sort of what I would call safe standards for opening anything back up in a significant way. And that could be a function of determining what types of businesses have the ability to deliver on a wide variety of parameters and protocols around distancing and safety and all the rest. A third precondition that people have talked about is you have to get to the point where the spread is growing at less than or around 1-to-1, right? As it was growing, the spread was growing at sort of one person represents 4 more. And that was pretty much why we did all the stuff we did to put the Commonwealth and much of the rest of the country into sort of a self-induced coma so that we could actually take down the rapid nature of the spread that was occurring, which means almost everybody who talks about this says there has to be a ton of testing going on We've been doing a lot of testing. We're a top 10 tester on a per capita basis, but if you were to say to any of us up here, are we doing enough testing? We would say no. And if you talk to most other states, they would say the same thing. And the call we had earlier today with the Vice President, with most of the governors, was all about testing and the fundamental notion that we need to do a lot more testing because that's a big part of surveillance if we're going to get to the point where we can start thinking about how to make people believe that it's safe to go back to work, safe to go back to doing some things they did before and all the rest. So I think there's a sort of growing sense about what things need to be part of any process to sort of turn the corner here. And I would expect and anticipate that those things would be addressed in any kind of plan to move the country or the Commonwealth or the region forward.
But Governor, are you concerned that the president might in some way trump you, so to speak, on making this decision on when to reopen the state of Massachusetts?
Well, like I said, the call we had today with the Vice President and his team was all about testing, which says to me that they get the fact that we need to do a lot more testing, a lot more quickly, for surveillance purposes, if nothing else. And we plan to use a lot of that testing to do the tracing that, as we've talked to you about before, is what we're ramping up to be one of the major ways we deal with issues around identification and isolation. Another way to stop the spread on a go-forward basis.
Governor,
Do you or the secretary?
I wanted to ask you about the nursing home numbers, about deaths that have started to come out now.
Yep.
They're stunningly large and sort of point to where the major problem exists. But I don't hear a major shift in your strategy in terms of dealing with it. What's your reaction to those numbers?
Well, first of all, my dad's in one of those facilities, so I take this stuff pretty seriously. Secondly, we have 1,000 facilities that fall into sort of the assisted living, long-term care, senior care category in Massachusetts. And it is by far the most difficult kind of facility because of the nature of the population, the nature of the work, and the nature of the way they're organized and the way they support and serve their residents to manage against a contagion like COVID and COVID-19. And out of those 1,000 facilities, there are 140 that have had one case, at least one case. So that means so far, this has been going on now for, depending upon when you think it first started, perhaps as long as 3 months, 860 or more of 1,000 facilities that would have been deemed by anybody as the most vulnerable to begin with don't have a single case, which is quite a tribute, I think, to a lot of the folks who work in many of those institutions, and we shouldn't forget that. The second thing I would say is we've adjusted our policies many times since the start of this, and we were, in fact, one of the first states in the country to implement a no visitation policy. And I know how brutal that is because that one affects me personally, but many other states followed on that no visitation policy. And in retrospect, I'm really glad we did it. Because when we put that no visitation policy in place, most people weren't talking about the fact that significant portions of the population that actually gets infected and is in fact contagious associated with COVID-19 are asymptomatic. So you could have had family members walking in and out of facilities, hugging mom and dad, engaging in the traditional moments of joy that come with that, and all that time been carriers, which would have made this situation dramatically worse than it has been so far. But we've also changed a lot of our policies, and I would like to let Secretary Sutter speak to that.
So in addition to what the governor said, as you know, we rolled out mobile testing, and I won't go back over those numbers, as well as a dedicated family resource line. And in addition, originally we had been thinking of, well, we did, because we created the Beaumont Nursing Home as a COVID-19 home and moved patients who were non-COVID out of that facility into other facilities. There was a lot of concern about moving individuals from a facility that they were comfortable in. And so, as you know, we're now adding I think it's about 986 beds across Massachusetts in empty nursing homes where we're hiring up as COVID-19 nursing homes. In addition,
Speak to the rationale on that one. That may not be obvious to people why we did that.
so when we first were setting up the Beaumont nursing home and tested folks in the home, there was another nursing home, which I think has been pretty well reported, the Advinia in Wilmington, where we had understood there were no positive cases. So that was going to be the second nursing home where we were going to move people out and create that into a COVID-19 facility, but decided that it was important to test everyone before we engaged in moving patients around, which is obviously disruptive for people. And in doing that testing, more than half of the individuals who were asymptomatic tested positive. So that was clearly one of those moments where the combination of receiving some concern by a number of social workers and others around moving elderly residents to other nursing homes, but obviously the number of people who are asymptomatic who are testing positive, we needed to sort of pivot. And I think that's what we continue to do, is to try to find other strategies. So we've identified across the state a number of nursing homes that were recently decommissioned or had the ability to be, had been closed, that we could open back up. And then the challenge is hiring staff for those. So in fact, I think the governor may be going to visit one, or the lieutenant governor or me tomorrow, that's down on the Cape, that will be opening, I think by Saturday, as a COVID-19 positive nursing home, where we will have patients, residents who are COVID-19. So that's very important. The other thing that we have done, and was primarily over the weekend, is to really identify nursing homes where have issues with staffing, issues with infection control, whatever the issues are, and sort of identifying them. And we're not monitoring, which is, I think, historically what the Commonwealth did, was you'd monitor through plans of correction and compliance issues. This is like a very, as a social worker, a very aggressive sort of interaction with nursing homes to help find staff if staffing is the issue, bring in PPE if that is the issue, and help them stabilize in those conditions. And then we are working on creating dedicated COVID-19 isolation spaces within nursing homes, because one of the things about a nursing home, as you know, Bruce, is the staff and many other supports are coming in and out to the nursing home. So it's one thing to check temperature, but people may be asymptomatic. So how is it we can then, within a nursing home, create COVID positive wings, if you would, or areas, and then non-COVID positive wings, and then also try to not have staff, right, have staff stay within sort of their lanes, if you would, within those parts of the nursing home. And we'll be adjusting rates, as we announced last week. We're adjusting rates for those nursing homes that create that opportunity. As you know, we announced last week of, I think it's $50 million in nursing home rates, and then another $30 million for those nursing homes that sort of create these wings. So we continue to try to respond. We understand that individuals who are among the most vulnerable are people who are in 24/7 congregate care facilities.
Governor,
I just want to add one more point to this, which is there are many other states right now where nursing homes just generally have been ordered, because of lack of capacity and lack of step-down capacity, to take COVID-19 positive patients, even if they don't have any positive COVID-19 residents living in their nursing home. This is something that, from our point of view, was eye-opening and had a lot to do with why we made the decision to create explicitly COVID-19 positive skilled level nursing capacity, because we wanted those facilities to be staffed and geared and trained to serve that population, and not end up in a situation where we would be putting, because we had to, COVID-19 positive people into nursing homes where there was no COVID-19 to begin with, which then creates all the issues that the Secretary just talked about. So I actually think we've taken pretty seriously the importance of coming up with strategies to do all we can, given the circumstances associated with the population, the operating model, and the nature of that particular virus, to try to protect people to the best of our ability. And senior care and congregate care facilities.
Governor, how did the call to look at this? Did you give any advice?
I think I said the first time that I talked about this that neither he nor I are very good on the phone. That's still true.
Governor, could you or the Secretary elaborate a little bit on, I think you mentioned looking at facilities that had shortages in staffing or other issues. How exactly are those staffing levels going to be replenished? Is that from the,
Yeah.
I don't know if you could elaborate on that.
So we have been able to bring, so we have a long-term care portal that we established sometime last week specifically for individuals who want to work in long-term care. So between the long-term care portal and the portal we set up for volunteers, it has actually been successful. In addition, we have 2 contracts for nursing staff, which we've used for our homeless isolation hotels. So we've made that also available to nursing homes and the like. So, it is a bit of a patch. But between the long-term care portal and then our volunteer portal through the Mass Medical Society, and then extending our nursing contracts that we've had, we've been able to provide sufficient staffing up to and including this past weekend. Have not had issues with housekeeping staff per se, but that's one of the issues. So in each of the nursing homes where we have identified a significant number of COVID positive cases, and where they have indicated they have nursing, basically it's like a SWAT team approach as to what level, what shifts, and then we put together our resources. And as you know, all the volunteers who come through the Mass Medical Society have all been quarried and sorried, and the same thing that comes through our long-term care portal.
Governor, the Secretary mentioned we are currently in the eye of the storm. Can you elaborate a little bit on that, and have some of these surge projections changed at all in any way?
So the great thing about models is they are always subject to change. And if you look at any of the models that are out there, all the independent models, and the beauty of the internet, by the way, is when you change your model online, the historical one is gone unless whoever it is that's looking at your model has actually made note of what your model looked like 2 weeks ago or a week ago or a month ago. And we've said from the beginning that our models are as we see it at this time, okay? And I think the most important part about models is to understand that that's all it is. It's a model, it's a projection, it's a set of assumptions that you make, especially when you're dealing with a virus like this one, which no one's ever dealt with before, where you can use some historical data from someplace else and adjust it in some way to make you think that it normalizes a bit to your particular circumstances, but you need to understand it's a model. And so what we've really done, for the most part, is build capacity around the Commonwealth to make it possible for us to deal with what we would describe as a worst-case scenario, which we certainly hope never happens. And then it just becomes a function of tracking it to see how it moves against what you anticipated was going to be the issue. And I think we believe that our original projection, which is that our original projection was we thought we were going to start surging around the 7th of April to around the 17th of April, and then we moved it to the 10th to the 20th. And we talked last week with you all about the possibility that it might slide a little bit further. And if it does, we'll make adjustments. But fundamentally, the goal here is to make sure that you have enough capacity to be able to serve the COVID-19 population that you need to serve, and at the same time, still be able to deliver the health care to people who have other issues, traditional med-surg issues that hospitals and healthcare providers deal with every day. I've also said this before. If you look at what happened, especially in Italy, COVID just overwhelmed their healthcare system, and it wasn't just COVID patients that were dying, it was almost anybody who needed almost anything of a significant kind of medical intervention until they managed to get past the top of the surge. Our goal here is to get through this without putting people who have what we would describe as sort of potentially fatal, but curable and solvable conditions in a position where they can continue to get the service that they need and the medical care they need at the same time we deal with what comes with COVID. And when someone says to me, well, make this exact, it's not built to be exact, okay? It's built to be the kind of thing where you do the best you can with the smartest people you've got around you and the folks out in the community who can tell you what's going on in their facilities every single day, and then you work with them to build capacity, and then you do everything you can to make sure that you have enough beds and staff to solve the COVID-19 problem, and at the same time can still treat cancer and heart attacks and strokes and all the other stuff that is sort of traditionally what hospitals and healthcare, especially for and at the acute level, is all about. And if you were to say to me, is this going to last 10 days or 2 weeks? I don't know. I don't know. And what I do know is we've done a ton of work to build the capacity to deal with it sort of as it goes. And in all the conversations we have with folks in the healthcare community generally, I think they would all say that we have done with them many of the right things to prepare for this. But nobody's sitting there with an over-under on how many days they think this is going to last or what they think the total number of patients is going to be. And I think what everybody hopes is that we've over-prepared, because that would be a heck of a lot preferable to any other outcome.
Isn't the main objective of all this to keep pushing that date further away, further away, further away? And if we do that, we're successful?
I think of it as, the answer is yes, but, okay? If you have something that you think is going to look like this, right, and you manage to make it look like this, right, so you don't have the big peak, yeah, it's probably going to feel like it starts a little later and it's probably going to last a little longer, but you're not going to go through the part that absolutely takes down your healthcare system's ability to not just service those folks, but to take care of other people too. So the answer is yes, but part of the objective here is to try to create a bump that's within the context of what we can collectively, capably manage.
Have you seen any indication about whether there will be regional differences in that between Western Massachusetts and the rest of the state over the past few weeks?
Yeah, do you want to talk to that? I mean, I think what I would say about that is it depends upon which week, okay? While there is sort of a wave to this thing nationally, there's also a wave to this thing regionally, okay? And you see different hotspots pop up here or there, and then, the wave comes back, and there's a bit of a back and forth associated with it. It's not, there's nothing about this that looks consistent and predictable over time. It all looks different. Thanks.
Thank you.
And thank you, Brianna, for coming. Great stuff.